Jane and Ralph have a decision to make. Ralph has a history of heart disease, and his doctor would like to admit him to the hospital for some tests. The problem is, which hospital? Ralph is insured by Medicare, and he and Jane have a limited retirement income. He wants the best care possible, but he needs to make a sound financial decision. Fortunately, he can consult the IP Hospital Cost Explorer. The IP Hospital Cost Explorer compares inpatient costs for common procedures categorized by Medicare Severity diagnosis-related group. Ralph lives in Cincinnati. There are 3 hospitals he wants to check to see how much his treatment may cost: Good Samaritan Hospital, Christ Hospital, and University. First, he selects the heart category. Next, he zooms into the southwest Cincinnati region, then identifies the circles that represent each hospital. He notices that 2 of the 3 hospitals are colored green, and 1 of the hospitals is colored red, which means high hospital costs according to the Centers for Medicare and Medicaid data. Next, he wants to check actual costs, so he clicks on each circle. He sees that the cost to treat heart failure varies among hospitals. At Good Sam, heart failure treatment costs more than $21,000. It costs about $12,000 at Christ and $9,200 or so at University. Those are big differences. But cost isn't the only factor to consider. Ralph wonders, are patients satisfied with the treatment they receive? Fortunately, the IP Hospital Cost Explorer helps him answer that question too. The IP Hospital Cost Explorer also contains hospital compare data, the same data that appears on the Medicare.gov site. Ralph decides to look at patient survey results for each hospital. He discovers that 87% of patients would definitely recommend Christ Hospital, 78% would definitely recommend Good Samaritan Hospital, and 70% would definitely recommend University Hospital. It's time for Ralph to make a decision. Ralph decides to go to Christ. Ralph believes the difference in patient satisfaction scores makes Christ the best choice for him. The IP Hospital Cost Explorer helps patients like Ralph and their caregivers and families make informed choices and participate more fully in their own care. Maria is a researcher. She's interested in exploring Medicare costs and utilization across geographies and visualizing the demographics and prevalence of chronic conditions for the Medicare population. She can also use the IP Hospital Cost Explorer. Under the Tools menu, Maria selects the Medicare Data Portal. Since she's interested in the dual-eligible population, she selects the Medicare population category, then Beneficiary Characteristics by HRR, then Percent Eligible for Medicaid. This shows Maria how the dual-eligible population varies across geographies. Since she's also interested in viewing and exporting the raw data, Maria clicks on the Chart tab to see bar charts of how the data varies by region, and clicks on the Graph tab to see how it changes over time. The IP Hospital Cost Explorer helps researchers like Maria learn more about Medicare costs and utilization and visualize the demographics and prevalence of chronic conditions for the Medicare population. For more information, contact HealthLandscape at www.healthlandscape.org or email at info@healthlandscape.org.